Hello everyone. In this video we will talk about stress fractures. Stress fracture is a fracture in a normal bone that is subjected to chronic repetitive stress or overuse. So the bone is physiologically normal. It does not have any pathology in it, but because it is subjected to repeated stress due to some sort of exercise or other causes that we will see, it develops a fracture. It is induced by fatigue, hence it is also called fatigue fracture. The pathophysiology is that when a bone undergoes chronic repetitive stress, normally it undergoes remodeling and repair and it brings the bone back to normal. But when the stress keeps going on and it exceeds the remodeling capacity of the bone, it eventually results in trauma and causes stress fracture. Causes of a stress fracture include when a sedentary person suddenly starts to exercise, or it is also seen in athletes who do high impact exercises for long periods of time. It is seen in soldiers because they have to march repeatedly, and it is also seen in runners. The most common sites where we can see stress fractures are the metatarsals, especially the second metatarsal. It is seen in soldiers and it is also called march fracture, which of course is due to excessive marching in soldiers. In runners, there will be a runner's fracture which is seen in the distal shaft of the fibula. Other than that, these fractures can be seen in calcaneum bone, navicular bone, tibial shaft, the patella, and the neck of femur. Clinical features of a stress fracture include that there will be a history in rapid increase in exercise. There will be a patient who has suddenly started doing a lot of exercise, or there is a history of a runner or a dancer or a soldier, and that patient will present with pain and tenderness along the affected bone. The diagnosis of a stress fracture, for diagnosis, the investigation of choice is an MRI. MRI shows earliest evidences of a stress fracture much earlier than an X-ray, whereas an X-ray will show a fracture only after 3 weeks. So fresh fractures will not be shown by an X-ray. A bone scan has to be done if there are multiple stress fractures. For treatment, the best treatment is by giving rest for a period of 4 to 8 weeks. In this period, all painful activity should be avoided and activities should be resumed gradually. You shouldn't take up the activity suddenly, they should be resumed very gradually. An elastic bandage can be used. For muscles, rehabilitation is required. And in case of serious fractures, as in the neck of femur and tibial stress fractures, surgery may be necessary.